Oui, s'il vous plaît. Merci.
Oui.
On apprend aujourd'hui que presque tout le caucus du Bloc québécois est obligé de s'isoler parce qu'ils ont eu un caucus à Saint-Hyacinthe mardi. Et il y a une personne du personnel qui a la COVID-19. Alors, je me demandais jusqu'à quel point est-ce que c'est sage de faire ce que vous avez fait aujourd'hui, de vous rencontrer ici?
Bon, ben vous m'apprenez des nouvelles concernant le caucus au Québec. Bien sûr, il faut prendre toutes les précautions. Et je pense que ce qu'on fait durant cette journée, on respecte toutes les précautions de distanciation et puis se laver les mains.
C'est ce qu'on fait aussi, mais...
Il faut quand même que le gouvernement continue de fonctionner. Et alors, on a pris des mesures spéciales et je pense qu'on a fait tout ce qui était nécessaire pour s'assurer qu'on minimise la possibilité.
Est-ce qu'on a trouvé des pistes pour convaincre les gens que c'est toujours important de respecter les directives sanitaires? Dans le message, il y avait une réflexion aujourd'hui qui avait cours pour essayer de voir comment on convainc les Canadiens de continuer d'être disciplinés. Est-ce que vous avez trouvé ces pistes-là aujourd'hui?
Bien, c'est un message qu'il faut répéter et je suis très heureux de dire que la grande majorité des Canadiens respectent le besoin de garder ses distances, de se laver les mains et tout ça. Alors, mais il faut continuer de passer le message parce qu'il y a certaines personnes qui résistent la nécessité de le faire et mettre les autres à risque. Alors, on continue de passer le message. Well, by continually repeating it. The majority of Canadians understand it and are very respectful of it. Some people need to be reminded that they're putting other people at risk and that it's important for them to do it. So we'll just continue passing that message and hopefully we'll get there with everybody.
Mr. Garnoy, Mr. Garnoy.
I think I'm going to go first.
Sorry, I didn't see you. I don't know how I missed you. Sorry.
I'm hard to miss. Good evening.
Good evening, Mr. Blair. I'm wondering with the rising case numbers, how you balance the message about Canadians needing to be vigilant with fatigue about coronavirus.
You know, I've been very impressed with Canadians' willingness to, I think overwhelmingly the majority of them are being exceptionally responsible. You know, they're concerned about their families and about their fellow citizens. And I think we'll continue to remind them about the importance of maintaining vigilance. We understand people are getting weary. Kids are going back to school. People are very anxious to get back to the normal course of life. But I don't think we can relax our vigilance at this point in time. We still got work to do.
Mr. Blair, I noticed outside a lot of the drivers for the ministers are all congregating together, maybe a foot apart, nobody's wearing masks, they're all chatting and talking. How is that sending the right message?
Well, I think clearly, I'll remind them when I go out because it's important that all Canadians understand the importance, not just of protecting themselves, but protecting their loved ones and protecting their family and friends. We all have to act responsibly. We're not through this yet. And as we've seen, as the numbers begin to creep back up, we have to maintain vigilance. We have also demonstrated, I think, that Canadians have done generally very well in this pandemic, and we've done it because we've all acted in a very responsible way. We'll just continue to remind Canadians of the importance of it.
Minister Blair, your government is preparing to deliver a speech from the throne in about 9 days from now. There's already been so much government spending on various programs for COVID-19. I'm just wondering, when you have the big five banks warning your finance minister, your colleague, Minister Freeland, to rein in the spending, and now you're talking about the possibility of a guaranteed basic income.
I have every confidence in our finance minister to strike the all-important balance. Of course, we're responsible with every expenditure. We see it, every expenditure as an investment, but we're also there for Canadians. And certainly during this COVID pandemic, Canadians have gone through a very difficult time. We've done everything we can to support them, and we're going to continue to support them. Thank you very much.
Merci. Monsieur Trudeau, est-ce qu'il y a une limite à ce que le Canada peut se permettre en termes de déficit pour sortir de cette crise-là et en termes de relance économique?
Bien, deux choses rapides. La première, c'est que nous sommes évidemment dans une situation favorable d'un point de vue international, mais aussi d'un point de vue historique. Nous avons au Canada un des taux d'endettement par rapport à la taille d'économie les plus faibles de tous les pays développés et certainement un des plus faibles dans l'histoire du pays. Ce qui est une excellente nouvelle puisque ça nous a permis d'investir, comme vous le savez, de manière à faire une deuxième chose, c'est-à-dire de s'assurer que nous n'entrions pas dans une dépression au lieu de vivre une récession. Alors, une récession, c'est quelque chose qui est déjà très mauvais, mais une dépression, c'est comme un mauvais rhume qui se transforme en pneumonie. C'est une récession qui devient une dépression, et ça, il fallait absolument l'éviter.
Est-ce qu'il y a un chiffre identifié? Est-ce que c'est 100 milliards dans 10 ans? Est-ce que c'est 50 milliards? Est-ce qu'il y a un chiffre identifié?
Alors, évidemment, les montants sont très importants pour l'instant, mais ce sont des montants qui sont investis pour garantir l'intégrité économique et sociale du pays. Il faut qu'on...
Est-ce qu'il y a un chiffre, une cible qui est identifiée sur 5 ans, par exemple?
C'est ce que Mme Freeland, évidemment, et nous-mêmes, les membres du cabinet, sommes en train de discuter et on va en savoir bientôt davantage. So there are two important things in that particular respect. First, Canada has historically and relatively speaking one of the lowest debt to GDP ratios, both in terms of other countries and also in terms of what we have seen over the years and the decades in Canada. And second thing, we need to keep investing in Canadians to avoid moving from a recession to a depression. A depression is like a pneumonia that you have come to because you didn't heal, you didn't look after your cold. So a cold is a recession. You don't want to go into pneumonia and a depression.
But if the debt to GDP ratio is no longer the fiscal anchor, then where do we go?
Well, this is exactly this is part of course, of our discussion now because we are in a very different environment. We are in the middle of a pandemic, which is hurting millions of Canadians. So we're operating and focusing very much on the short term to make sure that we emerge as strongly as possible out of this crisis.
Is the government listening to the big five banks when they say, listen, you know, at some point you're going to have to get a control on spending? I mean, what's the line?
Of course, we are listening to every Canadian, including the financial sector, because there's obviously a strong connection between what we call the real sector and the financial sector, but we're also very focused on the real needs of Canadians.
All right, thank you. Thank you.
Qui ont dit c'est pas vrai, mais regardez, je suis ici.
Ah, c'est pas bon, moi je vous croyais.
C'est pas vous, d'accord.
Je vous croyais. Je veux savoir, les bloquistes, tous les bloquistes sont obligés de s'isoler parce qu'ils se sont rencontrés en caucus à Saint-Hyacinthe mardi et il y a quelqu'un du staff qui a la COVID. Donc, je me demande jusqu'à quel point est-ce que c'était sage pour vous aujourd'hui de vous voir en personne. Est-ce que c'est vraiment une bonne idée alors que le nombre de cas augmente au Québec et en Ontario?
Bien, nous avons suivi évidemment toutes les mesures édictées par les autorités en santé publique. Nous portons nos masques lorsque nous sommes debout, même assis. Nous avons accès à une très grande salle, donc nous avons pu continuer à faire de la distanciation physique dans la salle. Alors, on a pris beaucoup de précautions, évidemment, le lavage des mains. Vous m'avez vu faire quand je suis arrivé ce matin. Nous avons continué à faire ça pendant la journée. Je pense que si ce que nos médecins en santé publique nous disent, c'est que ce n'est pas d'arrêter de se voir, mais c'est de prendre des précautions et de faire très attention. Et c'est ce que nous avons fait.
C'est ce qu'ils ont fait eux aussi. La réalité, c'est qu'une fois qu'il y a une personne là, que vous avez rencontrée aujourd'hui qui est malade, même si elle l'a pas, même si vous ne l'avez pas touché, vous allez être obligé de vous isoler. À une semaine, même pas du retour au Parlement, est-ce que c'est sage de se voir en personne?
Bien, on peut se faire tester et on peut avoir les résultats des tests assez rapidement. Bon, ça varie d'une province à l'autre, mais ça ne devrait pas nous empêcher d'être capable d'être au Parlement la semaine prochaine. S'il devait y avoir un problème, et encore une fois, je ne peux pas témoigner des mesures que le Bloc québécois a prises en matière de santé.
Merci.
C'est bon?
Merci.
Merci.
Bonjour, Mme Joly. Est-ce que vous pouvez nous clarifier un petit peu la position du parti sur l'application de la loi 101 au Québec? On sait que c'est une demande, notamment d'autres formations. Vous en êtes où? On sent que la porte est ouverte, mais ça peut être jusqu'où là-dessus?
Bien, nous, on est prêts à avoir des bonnes conversations avec le gouvernement du Québec. Vous m'avez posé la question ce matin. On a toujours dit qu'on était en faveur de la protection du fait français et que le gouvernement fédéral, on était un partenaire à ce niveau-là. Donc, je pense que ça vaut la peine qu'on puisse avoir ces conversations-là. Je suis déjà en contact avec Sonia Lebel à ce niveau-là, puisqu'elle est en charge de toutes les questions en lien avec la francophonie canadienne. Ça me fait plaisir d'avoir des conversations avec Simon Jolin-Barrette également, et je comprends aussi que mon collègue Pablo Rodriguez a ces conversations-là aussi.
Est-ce qu'il y a des risques de réactions négatives du côté de la communauté anglophone, peut-être, ou ailleurs au Canada? Comment vous jugez ça?
On sera toujours là pour défendre nos minorités linguistiques. Ça fait partie de notre vision, de notre mission et de nos obligations constitutionnelles.
Réaction peut-être sur ce qui se passe au caucus du Bloc québécois, tout le monde en isolement préventif. C'est une bonne idée de se rencontrer en personne, essentiellement. Mais
écoutez, on a eu l'approbation de la Dr Tam, qui est la médecin en charge de la santé publique au Canada. Elle a participé de façon virtuelle à nos rencontres. Alors, on peut être dans le fond, très à l'aise avec la façon dont on a fonctionné. C'est important pour nous de se rencontrer pour préparer la rentrée parlementaire, mais aussi gérer la pandémie. Et on va toujours, encore et toujours, respecter les conseils de santé publique.
Minister, when it comes to managing the pandemic, when is the time that the government says we're going to put the brakes on rolling back some of these programs, like the SERV, like other programs that have been put in place to help Canadians who are struggling to get by right now? When do you say, you know what, we're actually going to extend these programs, given the rising cases that we're seeing in Ontario and Quebec?
Well, we already know that many of our measures are there for until December 31st, including the wage subsidy, which makes sure that 3 million Canadians have a job right now, and we've extended the rent subsidy. We've extended also the $40,000 loans, the CEBA accounts. And I think the most important thing is that Canadians stay healthy, because that's their best way to make sure that there is economic recovery. What we've shown throughout this pandemic is that we're there for Canadians. We've got their back, and should things worsen, we will be there. So we've been there, we're there, and we will be there.
You're saying, you know,
thank you. Thank you. Thank you.
Go girl.
Minister, the Bloc caucus, almost all of it, has to go into isolation because they met as a caucus on Tuesday, and someone from the staff got a positive test today. So I'm wondering how good an idea for you is to meet in person here today.
Well, certainly these are the kinds of decisions Canadians are making all the time in their workplaces. And of course, we've taken precautions. We've physically distanced, as you can see. We're wearing masks, certainly spread out. Some of our colleagues are meeting virtually with us. But that is the reality of living with COVID-19, is that if someone tests positive and public health determines that the close contacts are at risk of being infected and could potentially spread the disease, that people need to isolate. Now, the good news is we've come a long way with virtual ability to work, so I've been essentially isolating in Thunder Bay, and I would, obviously have the tools to continue working if I was isolating from my apartment or wherever I would have to isolate.
Yes, but just like a few days before House comes back and the Trump speech, wouldn't it be a better idea to have this meeting on video conference, like you've been doing before, all of you?
I think it's really important that we also have an opportunity to gather and to meet in person, and you can see that those are the challenges and balances that employers are making as well in Canadian workplaces all around the country. Schools are back, teachers are back with students, and we know that this is part of restarting our economy, and it's really about balancing the risk with the benefits of gathering in person. And as I mentioned before, the organizers of the retreat took precautions, made sure that tables were set with appropriate amounts of distance. We have been wearing masks, as I said, certainly protecting ourselves and the ones around us.
Minister, when you see the cases rising rather dramatically in the last few days, I guess how worried are you that the message out there to Canadians is not getting through? Like, what else can be done to say, like, look, I know you're tired, but how do you get that message out to Canadians?
Well, I think it is very much communications, and of course at the federal level through Public Health Agency of Canada we have a number of communications campaigns running for different audiences. We're also working really closely with provincial levels of government and local levels of government, not just on communications but on practical tools. So for example, this weekend I was working with Peel Public Health, the Mayor of Brampton, who I've had an opportunity to speak with, and the Mayor of Mississauga to ensure that we could actually bring federal resources directly to Peel to help reduce those cases. So we have now, for example, developed something called the Rapid Response Team or Plan. Essentially, we can move in with, for example, isolation housing, like the housing I announced in Toronto last week. We can also bring in experts, epidemiologists, for example, extra contact tracing. We have contact tracers that are trained and ready to go, multiple languages at Service Canada. And we can even work with partners and provide services through, for example, the Red Cross, should there need be for additional emergency housing or services and supports for people who are isolating. And when I spoke with Dr. Lowe at Peel Public Health, he was very relieved to know that we can be there. So that actually is part of our goal, not just communications, but helping to put out those outbreaks as they emerge.
Everybody's talking about the second wave. Are you worried about a second wave? Are we close? Are we far? How do you evaluate? Because you got a presentation today from all the
Absolutely, and today we talked about the various different scenarios that we might be facing. One thing we're certain of, we are living with COVID, and we're in that stage now where we're learning as a society to live with COVID, and you can see that across the country. Provinces are grappling with how to restart the economy in a safe way, but also balance the needs of individuals to continue to work and to continue to live in their communities. And so we talked about various scenarios. One would be a slow burn, where you see these little bumps and peaks and valleys, and we work really hard to put out those outbreaks, as I spoke about. But the other scenario could be a very severe fall surge, and what we need to be is prepared for either of those potential outcomes.
What do we do? What do we do about this? You're the health minister, and you're the one leading Canada's efforts on a national stage with this virus. When do you say to provinces, we've given you autonomy, we've given you authority to do your own sort of reopenings of your economies. When do you say to the provincial premiers, it's time to shut things back down?
Well, first of all, that's actually not how Canada works, and I'm sure you're aware of that. We have jurisdictional responsibilities and authorities, and the federal government does not shut down provinces and territories, nor would we ever do that, nor did it happen in the first wave. In fact, provinces and territories took appropriate measures based on their own set of circumstances, their own epidemiology. I think we're in a stage where I think we are in a stage where we need to work very closely with provinces and territories to have a much more surgical approach. I think a massive shutdown for a province or for the country, it's very difficult. It's difficult on Canadians, it's difficult on their mental health, it's difficult on their economic health, it's difficult on the economy of Canada. So the work that I'm doing right now is to try and support that more surgical approach. So we know, for example, in Ontario, it's not everywhere in Ontario. I come from Northern Ontario and Thunder Bay. Last time I checked, we had one active case. I also represent a town called Manitowoc that has never had a case. So does it make sense to shut down an entire province when you have entire regions that have never been affected by COVID-19, not from an economic perspective and not from a community functioning perspective. So as the health minister, my job is to work with provinces, territories, and local governments to say, how can we work to make sure we put these flames out, protect the populations that are most at risk, but also avoid that dramatic shutdown that we really did have to take in March as we readied all of our collective systems.
Minister, on the agenda tomorrow is recovery, right? How to sort of get through that. How difficult is it to talk about that when you are, of course, also grappling with those various scenarios of a possible surge?
I've always said that you actually can't have one without the other. You have to have a health plan and a health recovery plan and an economic plan, and they have to go hand in hand. And we see that in other countries that are experiencing extreme surges, where they've tried to make a choice between the economy and the health of their citizens, but in fact what happens is both collapses. Because if in fact people are too sick to work or too afraid to go out or just hospital systems in surge, you see in fact a decline of the economic activity of that country. And so that's the work that we're doing carefully together and planning for in the next several months ahead. Continue the work to protect the health of Canadians and the economy simultaneously.
I just want to clarify something, because you were talking about those two scenarios. What does the number tell you right now? Is that a possibility that we would face that big wave you're talking about?
There is
are we heading there?
There is always a possibility that the numbers could grow exponentially. Governments do the work that we do, and Canadians have to do the work that we need them to do, which is to continue to take the measures that we know are effective at driving down infections, reducing our gatherings, washing our hands, making sure that we stay home if we're sick, making sure that we wear face masks when we can't physically distance more than 2 meters apart. Those are the kinds of things that will help reduce infections, and all Canadians should take this very seriously. This is a sneaky virus. It can easily infiltrate communities, households, and we have to take it seriously. We cannot let up. Thank you.
Thank you. Thank you.